This video will demonstrate the documentation of a code in Epic, and we're going to use our patient Tom Father's Day for the example. It actually is Father's Day coming up, and with that said, our first step is going to be to look under the code status for the patient, and it does indicate no code status on file. So this individual we're going to treat as a full code. So I'm going to access Mr. Father's Day chart, and then I'm going to go up to, in the right-hand corner, the activities drop down and select code documentation. This will take you to a screen with an event log to document the code. So we're going to start by selecting code, and it will auto-populate with the time and date, and then we're going to click accept. And notice in your event log, we now have code start. So I'm going to document or demonstrate documentation of the staff. So if I'm the individual doing the code documentation, I need to document staff arrival and interventions as the process moves forward. So I'm going to, in this case, pretend that Miranda McLeod was the arriving nurse, and she arrived right at the beginning, and that now also is populated in my event log. So she's the one that found the patient. She's going to call the code. We're going to pretend we're on an inpatient unit. However, if it was in the emergency department, for example, you would document treatment prior to arrival, depending on where the patient is located. So in this case, we've got the code start, the staff that's arrived, and then now we're going to start documenting the code onset. So this is going to provide some of the details about the code itself. So when she arrived, we're going to say the patient was conscious, it was witnessed, but the patient went unresponsive and she doesn't really know what happened. So when it was identified, there was no pulse, there was no respirations, and then the patient is not ventilated. So in this scenario, she arrives in the room. While she's in there, the patient goes unconscious. She sees that and calls the code. Next, as I said, patient treatment prior to arrival is not applicable here. The vital signs can be entered via this topic dropdown, or they can be entered here. But in those first 2 minutes, we're going to be doing our ABC interventions and getting the pads on the patient. So basically, we're going to say that Miranda started compressions right away. They did get the pads on, and the patient isn't intubated, but they are doing respirations with an ambu bag. So I might add staff also. We're going to say respiratory arrived. And let's see, we'll just pick someone from the list, but you would have relevant staff on your drop down and then accept. So now I've got respiratory there. They're doing my respirations. So coming back here, any external pacing, output capturing. So we haven't done the shock yet. We just have the compressions and the ambu bag. So I'm going to click accept. This again is being done quickly to demonstrate the documentation and the process. Another key documentation in the process of code documentation is the documentation of the defibrillation. So the Zoll defibrillator is a biphasic defibrillator, and per ACLS guidelines, you would be doing your ongoing compressions. And when the shock was advised, in this example, we mentioned VFib, it would be at 200 joules. And this is how you would document the defibrillation component. At this point, the rhythm is being assessed, and you know that the patient is in VFib. So we're going to, the physician who just arrived, going to go up here and add our physician. And again, I'm just going to grab somebody off of here. And now we're going to document that the medication is being given. So we're going to pick the epinephrine given by the nurse, 1 milligram, given IV. We're going to say left antecubital, and then time and date, and then that's going to document in your event log as well. So this is just a quick demonstration of how to access the code documentation, which is via this dropdown, and then the general processes of documentation during the actual code. The next step, you're going to go down to your code outcome. So we're going to say the patient was worked on, they got their epinephrine, they have been shocked as appropriate, and fortunately, this patient had a spontaneous return to circulation. So, oops, I think I need to go back and select survival, return of spontaneous. Yep. Then who was notified? So in this case, the family was outside the door, anxiously awaiting the outcome, and it was a spouse. And then we're going to document the code end. So this is the time and date of when the code ended, and you would document accept. So the main um, review is access via code documentation. Be sure to add staff. And when you do the code end, it will automatically show the staff as departed. You don't have to go in and document that individually. When the code is initiated, you select code start. Be sure to document who's on site, the code onset, and the interventions are documented here, as well as the medications are pulled from the common ACLS medications. Be sure if a bolus is given that it's documented as a bolus. Thanks for watching.